At MedElite, trust is the foundation of everything we do. Whether you are a nurse practitioner treating a resident in a facility, a care coordinator reviewing charts at one of our offices, or a staff member logging into ROFE or EMSO to manage daily tasks, you hold the keys to our patients' most sensitive data. In the next few minutes, we will cover the essentials of HIPAA. You will learn exactly what information you are required to protect, how to handle data safely using our specific tools, and the real-world consequences of letting that safety slip. Let's get started.
So, what is HIPAA? It stands for the Health Insurance Portability and Accountability Act. Its core purpose is simple: to protect protected health information from improper use or disclosure. It ensures that private medical data stays private and is only shared when absolutely necessary. A common misconception is that HIPAA only applies to doctors and nurses. That is false. HIPAA applies to everyone at MedElite and our partner organizations. If you work here, you are bound by this federal law.
To follow the law, you need to know what you are protecting. The most important term is PHI, or Protected Health Information. PHI is any information that relates to a person's health status, care, or payment that can be linked back to them. In your day-to-day work, a HIPAA violation isn't usually a hacker in a hoodie. It looks like a printed medical record left forgotten in the communal office printer, an NP discussing a resident's diagnosis in a crowded facility hallway where visitors or other residents can hear, or a patient's name visible on your laptop during an unrelated virtual meeting. If it identifies the patient and relates to their health, it is PHI. We also handle PII, personally identifiable information, such as social security numbers and financial records. Both require the highest level of security.
Now that we've defined our terms, let's look at the 3 rules HIPAA uses to protect it. First is the privacy rule. This covers how we share information. It is built on the minimum necessary and need-to-know principles. Here is the distinction. You absolutely should access patient records in ROFE or EMSO to perform your specific job duties. However, you must never browse charts of patients you aren't treating or look up records out of curiosity. If it's not for your active task, don't click it. Second is the security rule. This focuses on digital protection. It requires us to use strong, unique passwords for our systems like ROFE and EMSO and ensures we never share those login credentials with anyone. Third is the breach notification rule. This mandates that we report any unauthorized leaks. If you see something like a file sent to the wrong email or a laptop left unlocked, speak up. Reporting a mistake immediately is always better than hiding it.
You might be wondering, if privacy is so strict, how do we collaborate and work with each other to provide care? HIPAA allows us to share PHI without patient consent for 3 specific reasons, known as TPO, Treatment, Payment, and Healthcare Operations. Treatment: an infinite medical provider sharing a care plan with a facility's director of nursing. Payment: our billing team sending records to Medicare or insurance payers to get claims approved. Operations: MedElite staff reviewing data for quality assurance or internal audits. Since MedElite provides management services, we operate under a Business Associate Agreement, or BAA. This legally binds us to protect the data just as strictly as the medical providers do. However, there is one major exception: psychotherapy notes. These are highly sensitive and can never be disclosed without specific authorization from the patient.
Compliance happens in the small choices you make every day. Here is how to safeguard data at MedElite. Physically. Never leave documents unattended. If you print a report, retrieve it immediately. If you leave your desk, lock your screen every single time. Digitally. We have strict rules on technology. At MedElite, we operate within Google Workspace. You may securely use Gmail, Google Chat, and Google Meet for business communication. However, you must never use unapproved platforms for patient information. No WhatsApp, no iMessage or SMS texts, no social media. Never post photos or details about a resident, even if you don't use their name. Sending a patient update via text or posting on social media is a direct HIPAA violation. It is unencrypted and leaves a permanent record on a device we cannot control. Keep all patient communication within our secure, approved platforms.
The consequences of ignoring these rules are severe. Violations fall into 4 tiers based on severity. Tier 1 is lack of awareness. This is an honest mistake where you didn't know the rule. The penalty starts at $100 per violation. Tier 2 is reasonable cause. This means you should have known better, but didn't act with willful neglect. The penalty rises to $1,000 per violation. Tier 3 is willful neglect that you corrected. You knew the rule, ignored it, but fixed it within 30 days. The penalty jumps to $10,000 per violation. Tier 4 is willful neglect that was ignored. This is when a known risk is ignored for too long. The penalty is $50,000 per violation, up to a maximum of $1.5 million per year. Beyond fines, violations can lead to termination of employment, loss of professional licensure, and even prison time.
Protecting patient privacy is not just a law, it is a promise we make to those we serve and take care of. If you ever suspect a breach or even a close call, contact your supervisor, manager, or the compliance team immediately. Thank you for your attention. To receive credit for this mandatory training, you must now complete the steps below this video. First, check the box to attest that you have watched this video in full. Second, proceed to the next section to take and pass the mandatory compliance quiz.